Hello, I'm BMillzebub, and welcome to my channel and a new sex ed video. I do like to try to space these out, but Tori, the Great Queen of Hell, retweeted Dr. May J, and the topic of endometriosis piqued my interest. And I figured that it could potentially help people who need it, and who am I to hold out on that help? So let's talk about endometriosis after a quick disclaimer. I am not a medical professional. The content of this video is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. I'm getting my information from the Mayo Clinic, and you can find the link to the articles I'm using for sources in the description below. So endometriosis often, is quite painful, and many doctors, unfortunately, will often write off the pain as just being heavy or painful menstruation. What this is the endometrial tissue growing outside of the uterus, most commonly involving the ovaries, fallopian tubes, and the tissue lining your pelvis. What these endometrial tissues do is actually just what they're supposed to. They thicken, break down, and bleed with the menstrual cycle. The problem is that there's nowhere for this bleeding to go because it's grown on the outside of the reproductive organs rather than on the inside. It doesn't stop there. Nearby tissue can become irritated by it, causing scar tissue and adhesions, which are abnormal bands of fibrous tissue that can cause pelvic tissues and organs to stick to each other. And if your ovaries are affected by it, it could possibly cause cysts to form. If you think you may have endometriosis, you should schedule an appointment with your doctor. If your doctor tries to just brush you off, demand a second opinion. This is the one and only body you get in your life, so you should take care of it. Don't let a doctor dismiss you out of hand because it's probably just a heavy period. See a doctor who actually gives a damn about you. But to determine if you think you should see a doctor in the first place, what are the symptoms you should be on the lookout for? I'm going to be reading directly from the website here so I don't accidentally give you any wrong information or cause some misunderstanding, because I want you to be healthy, and that can't happen if you're misinformed. The primary symptom of endometriosis is pelvic pain, often associated with menstrual periods. Although many experience cramping during their menstrual periods, those with endometriosis typically describe menstrual pain that's far worse than usual. Pain may also increase over time. Common signs and symptoms of endometriosis include painful periods, dysmenorrhea. Pelvic pain and cramping may begin before and extend several days into a menstrual period. You may also have lower back and abdominal pain. Pain with intercourse. Pain during or after sex is common with endometriosis. Pain with bowel movements or urination. You're most likely to experience these symptoms during a menstrual period. Excessive bleeding. You may experience occasional heavy menstrual periods or bleeding between periods, intermenstrual bleeding. Infertility. Sometimes endometriosis is first diagnosed in those seeking treatment for infertility. Other signs and symptoms: you may experience fatigue, diarrhea, constipation, bloating, or nausea, especially during menstrual periods. The severity of your pain isn't necessarily a reliable indicator of the extent of the condition. You could have mild endometriosis with severe pain, or you could have advanced endometriosis with little or no pain. Endometriosis is sometimes mistaken for other conditions that can cause pelvic pain, such as pelvic inflammatory disease, PID, or ovarian cysts. It may be confused with irritable bowel syndrome, IBS, a condition that causes bouts of diarrhea, constipation, and abdominal cramping. IBS can accompany endometriosis, which can complicate the diagnosis. All right, so let's say you've decided that you want to speak to your doctor and see if you get a diagnosis of endometriosis. What are the possible tests your doctor could use to determine if you do in fact have endometriosis? Your doctor could want to perform a pelvic exam. I'm sure many of you out there are already familiar with this test, but for those of you who aren't familiar, I'll briefly explain. A pelvic exam is where a doctor feels the areas in your pelvis for abnormalities like cysts on your reproductive organs or scars behind your uterus. Although it can be impossible to feel small areas of endometriosis unless it's caused a cyst. They could perform an ultrasound, which uses high-frequency sound waves to create images of the inside of your body. They could press the transducer, which is a device used to get an image by pressing it on your abdomen or inserting it into your vagina. This is called a transvaginal ultrasound. Your doctor could want to perform both the standard ultrasound as well as the transvaginal ultrasound to get the best picture of what's going on with your reproductive organs. It should be noted that the standard ultrasound test won't be definitive, but can identify cysts that are associated with endometriosis. Another test would be an MRI or magnetic resonance imaging. This will possibly be used for surgical assistance so the surgeon can more easily find endometrial tissue for removal. Or you could get a laparoscopy. This one's probably the least likely because it involves you being under general anesthesia and a surgeon. What happens during a laparoscopy is the surgeon will make a small incision near the navel and insert a laparoscope. This can give the surgeon information like the size and extent of the endometriosis, and they can take a biopsy of it while they're still in there. And if the surgery is properly planned, they can treat endometriosis right then and there, so you only have to undergo one surgery. That's a pretty sweet deal if that's the case for you. I'm sure you're curious about what can cause endometriosis so you can somehow prevent it. And I do hate to be the bearer of bad news, but the cause of it is unknown. I will briefly mention possible causes before talking about the risk factors that increase the chances of it, as those are more well known. The possible causes are retrograde menstruation, transformation of peritoneal cells, embryonic cell transformation, surgical scar implantation, endometrial cell transport, and immune system disorder. If you'd like to look further into those, you can find a link to the Mayo Clinic article on symptoms and causes, where there's a short explanation of each of them, or do more in-depth research on your own. I opted to not spend all that much time on its causes as, again, it's really not known what causes endometriosis. But let's talk about the risk factors that increase your chances of getting endometriosis. And again, I'll be reading directly from the Mayo Clinic article for accuracy. Never giving birth, starting your period at an early age, going through menopause at an older age, short menstrual cycles, for instance, less than 27 days, heavy menstrual periods that last longer than 7 days, having higher levels of estrogen in your body or a greater lifetime exposure to estrogen your body produces, low body mass index, one or more relatives, mother, aunt, or sister with endometriosis, any medical condition that prevents the normal passage of menstrual flow out of the body, reproductive tract abnormalities. Endometriosis usually develops several years after the onset of menstruation or menarche. Signs and symptoms of endometriosis may temporarily improve with pregnancy and may go away completely with menopause unless you're taking estrogen. Now let's round out the video with something I know you're all going to be so excited to hear about: the potential complications of endometriosis. One is infertility. The way you receive this news will depend on how badly or if you want to have kids. And about 1/3 to 1/2 of people with endometriosis will have trouble getting pregnant. If you want kids, your doctor will likely urge you to not put it off, as the condition could worsen and make having kids more difficult. The other possible complication is cancer. As much of a downer cancer can be, there's a ray of sunshine coming through that cloud. While people who have endometriosis do have a higher risk of ovarian cancer, the overall lifetime risk of ovarian cancer is low. That's the good news. There is another form of cancer called endometriosis-associated adenocarcinoma, but the ray of sunshine there is that it's also rare. So if you think there's a chance you have endometriosis, I encourage you to see your doctor, and again, don't accept an attempt at a brush off. If a doctor doesn't take you seriously because of your female bits, demand they know why they didn't perform the tests and seek a second opinion, preferably from a doctor who isn't a complete bag of shit. That'll do it for this one though. If you found it informative, please leave the video a like, subscribe to the channel if you haven't already, and click the notification bell to get notified every time I upload a new video, and share this one while you're here. There's really no telling who this could possibly help. If you feel so inclined to help me out, consider supporting me on Patreon, where $5 monthly patrons get early access to most videos, or consider getting me something from my Amazon wishlist. Every little bit helps, and every little bit is greatly appreciated. Don't forget to follow me on Twitter, which you can find linked with everything else in the link tree in the description box below. Take it easy, everyone, and I'll see you all in the next one.